Good evening. I'm George Latimer, Westchester County Executive, and welcome to a continuation of our COVID-19 Town Hall series, where we discuss where we are in the expanse of the coronavirus outbreak. And we do that along with both medical professionals and some of our key municipal leaders. And tonight, I'm very happy in this session to have with us Dr. Charlita Amler, who is our Commissioner of Health for Westchester County. She has been the point person on all of these issues relative to COVID, and we've relied on her professional knowledge, both as a medical professional and also with the knowledge of public health, in order to help steer us through the decisions that are ahead of us. And then we have three of the most outstanding municipal leaders in the county. We have the mayor of the city of White Plains, the Honorable Thomas Roach, is with us here. We have the mayor of the city of Peekskill, Andre Rainey, is with us, and the supervisor of the town of Yorktown, Matt Slater. And so, Tom, Matt, Andre, and Dr. Amler, thank you all very much for taking time tonight. We're very happy to have you with us.
Absolutely.
Happy to be here.
We're going to have a few words from each of our different guests, talk a little bit about the world that they're living in, and then we're going to go straight to questions that have been gleaned either from the comment section of this Facebook post, program rather, or those that have been submitted by text or other method. Catherine Chaffee, our Director of Communications, is responsible for trying to correlating the questions, and there may be questions of similar types, so we'll try to bunch them together to make for a more cohesive set of comments. And if individuals want to talk about their own individual case, something that's important to them, we encourage you to communicate with us separately, communications@westchestergov.com. And if you have a particular case relative to you, we'll have that addressed outside of this more public forum where we expect people to ask more general questions. But we'll start by taking a once around Westchester County. When we did this, I guess 2 weeks ago, we had the mayors of Yonkers, Mount Vernon, and New Rochelle with us. But every community is different. Every community has their own realities. We'll go first to the mayor of the city of Peekskill, Andre Rainey. Peekskill went through about a month and change of being designated a yellow zone, which created some restrictions in the way the business operated. On the basis of that, has been recently lifted by Governor Cuomo. So, Mayor Rainey, tell us a little bit about how the outbreak and the response by the people of Peekskill has been.
All right, thank you, George. I want to say thank you for welcoming me in the city of Peekskill here this evening, and to all of the other guys on the call. Thank you for being a part of this conversation as well. You know, it's been a lot. It's been a challenge for all of us. I can say it's been a gift and a curse, but more so a curse. And I say it's been a gift because during this pandemic, I don't think I've ever seen this community unify as much as they have to help one another in my lifetime of being here. And last summer when this first started, we had so many people. We still have a lot of people actually still contributing to trying to give back to the community. We've had countless food drives to address the needs of hunger in our community. We had so many people that are just come together with Feeding Westchester and other organizations, you know, Fred's Pantry, Westcop, providing financial support for those who may need help with their heat, with their oil, and everything else. So it's been a great experience to seeing the community come together. The school district has been working phenomenally hard. You know, with the graduation having to be virtual this year, and also having a parade rather than an actual celebration for the high school students. So it's been a challenge in the most part. Thankfully, we are out of the yellow zone. I want to say that this gives us hope. You know, we never gave up from the beginning, and it's been a fight. The key has been what we've learned. More importantly, has been messaging. You know, getting the message out to the people, reminding the people of the basics of what creates this spread in every municipality, especially ours. And thankfully and fortunately, the city of Peekskill has a very active community where everybody is involved one way or another. They want to help. They want to help distribute. You know, the Bean Runner Cafe. Every week they were creating, giving out for free. You know, between 100 and 300 masks for about a good 2 months of the summer for free, just to help promote safety. The downtown, the business improvement district, they created a campaign saying "We are Peekskill," and it just showed the diversity in the city of Peekskill during these challenging times. We are still together. We are still united. We are still Peekskill. And the Rotary Club and the vouchers from the county. You know, you guys really helped us with supporting the businesses. We've had to block off a lot of street roads just to allow restaurants to open up outside in order to try to save and continue their business during these challenging times. So it has been straight. It has been seriously a challenge for the city of Peekskill to see that we are out of the yellow zone, to see that there's a vaccine coming, to see that, the people of Peekskill are still believing and hoping and pushing forward to get through this together as a unified community, it really makes me proud. But I will say, when we first was introduced to COVID-19, I think even today, I hate to say this, but even today, there are a lot of people who still just don't believe how serious this virus is. And you do have your few, probably two or three out of the whole 30,000 people population we have here, but those two or three are very loud that they don't believe in wearing their mask still. They don't believe that, um, you know, forcing them to wear a mask is almost taking away their civil rights. But for the most part, we've learned a lot from this outbreak. We've learned a lot from this virus, and we've seen a lot in our community. And the only good thing out of this is, like I said, I've never seen the community unify so much in my entire life. And to see that we are finally out of the yellow zone is going to inspire more people to do the right thing, give people hope. It's been a checks and balances, it's been a roller coaster. We were up, we were down. We were one of the lowest cities in the county at one point. Then we were one of the highest growing cities with the population of active cases at one point. But to see that we're going back down, it inspires us and it gives us hope. I'm just looking forward to this 2021 year.
Well, and it's interesting too, Mr. Mayor, because I've had the chance to travel all over the county and every one of the communities. And when I've been to Peekskill with you for the opening of the Apple Farms complex, and then we went over to the farmers market, I saw people really trying to have as much normalcy as you can, given the fact that you're in a pandemic and you are taking care, social distancing and masks and all that stuff, and yet still trying to be active. I was there a few weeks later when I saw the Peekskill Hispanic Community Corporation giving out food at
Giving
701
out the food,
Washington,
yeah,
and I came with
yeah,
some
yeah.
masks, and that's a sense of energy that's certainly true there, and it's frankly it's true in every one of these communities across Westchester County. We live in a community, and unless we're somehow involved in something that gets us into many other communities, we really don't see the diversity and the scope. But if you go right down Route
Mhm.
35, you go into the town of Yorktown, which is a large community. It's got different, hubs between Yorktown Heights and Shrub Oak and so forth. Matt Slater has come on board after the 2019 election. Matt, you walk in the door, you don't even get 3 solid months on the job. Bang, here's a pandemic. Welcome to your new responsibilities. And yet, when I'm with you in Jefferson Valley, you've got it cranking. You've got mass delivery and tents. You got the full community out there, the council out there. So you really grabbed this thing by the horns, didn't you?
Well, I had no choice, Mr. County Executive, and thank you again for having me tonight. It was supposed to be an easy first year, but I guess I'm the rookie walking into the World Series. But we're here to play, and our town, just like you heard from my colleague over in Peekskill, our town never disappoints, and I'm a proud product of the town of Yorktown. I was raised in this community. I was taught how to meet these challenges by growing up in this community. And once again, our community, just like so many others across Westchester, responded in just so many amazing ways. But I want to begin, Mr. County Executive, by personally thanking you for just the incredible work, the incredible partnership, the amazing level of transparency, the level of candor, and the level of accessibility, not just for you, not just to you personally, but to your entire staff. And we are joined by Dr. Shalita Amler, who's been a great help for the town of Yorktown, for my administration, and the entire Department of Health, for that matter. And so I want to thank you both for all you've done for us. Just like we heard from Mayor Rainey, Yorktown is a very, very special community, just as Peekskill is. And I keep talking about this thing called the Yorktown Way, which I take so much pride in. And when you think you're down and out, when you're thinking you're climbing a mountain that has no end, you get a knock on the door from your neighbor or from a friend, and it's just so motivating that to know that you've got someone watching out for you, someone who's willing to step up to the plate and help you and your family without even asking. And that's what we've seen throughout this entire pandemic here in this community. And it's been so motivating for me, as you know, Mr. County Executive, as my colleagues know, when you're in this situation and you're exhausted and you can't imagine another day of it. You just see these acts of just pure community, of just pure generosity, and it really does motivate you to keep going and to keep fighting for your community. And that's what we've done. And that goes to not just me personally, but our entire town board, our entire community, our business community. We've done a lot of great things, I think, here in the town. And just like Mayor Rainey, it comes down to communication. And we've launched a community impact dashboard that our staff has been fantastic with continuing to update with as much information as we can. We've hosted over 70 similar meetings like these over social media in our community or government access channel. Again, because we want to educate the public, educate the residents about the situation here in Yorktown, and have them have all the information they need to make responsible and smart decisions. I've said it a million times to our residents, and now I'm getting stopped on the street with people repeating it back to me. Smart, responsible decisions, and so that's what we've been focused on. It really does come down to a partnership, though. Again, to you, Mr. County Executive, for helping us with the mask distribution up in Jefferson Valley several times, which was great, and including over at the Jefferson Valley Mall. We've had several of those types of events in different parts of our community, especially geared towards our seniors. And again, it's all about communication. It's all about coming together, and it's all about building those partnerships and relying on each other during such challenging times. Our food security task force got off the ground as a direct result of this pandemic, because our food pantries, like Mayor Rainey alluded to in his community, our food pantries saw an exponential growth, and unfortunately, that growth has actually continued. And now it seems to be leveling off. We had our food security task force meeting just this past Monday, and two of our food pantries, St. Mary's, which is up in Mohegan Lake, and the First Presbyterian Church, which is over at Route off of 132 and 202, right by Downing Park. They've still seen a very high volume of need in our community, and hunger is an issue that I think every community is starting to grapple with and recognize and identify and come to terms with the fact that there is hunger in each of our communities, and it's up to us as leaders to find ways to connect people with the proper services, to work with the county, to work with our local food pantries, and even our neighboring communities to help those in need. One of the things that we expanded during the pandemic, actually, our senior nutrition center, it's actually now making food, not just for the town of Yorktown, for our seniors in the town of Yorktown, our homebound seniors who qualify, but also for the town of Cortland and the town of Somers now. So we are continuing to offer that helping hand. And that's what makes not just the town of Yorktown, but this entire county such a special place to live, to raise a family, to run a business. Again, I call it the Yorktown way, but it goes well beyond the Yorktown borders, and it comes down to that partnership. So again, Mr. County Executive, thank you very much for having me tonight, and thank you for your incredible leadership during this very, very challenging time. Again, as someone who didn't have not even 2 months of experience under my belt, it was great to be able to pick up the phone and talk to you directly and to your staff and get some great direction and understanding of what the situation was. And I'm looking forward to continuing that partnership with all of you.
And Matt, it only seems like a few years ago, you and I were walking the halls of Albany on the state Senate side, and who knew we'd be sitting with these responsibilities right now. So congratulations on your efforts. And certainly you have a good partnership here in Westchester County, and we're happy to work with you in Yorktown and your colleagues elsewhere. And there are two communities, though, that are very near and dear to my heart. Every morning when I wake up, when I go to bed at night, I do that in the city of Rye, which is my home community, has been for 35 years. But the place of my employment is here in the city of White Plains, the center of the county. It's not exactly the geographic center of the county, but is the center in so many other ways, with corporate headquarters and retail, plenty of restaurants and plenty of organizational activities here. I do as many events in White Plains in a given month as I do in any other community. And I see Tom Roach day after day. This might have been our 5th day in a row, Tom. I don't know. I lose track of it. But you're out doing your community, and I have the pleasure from time to time of being next to you in some of these events to help support some of your efforts. So, and you run a pretty big community here, 60,000+ people. How is it here in the center of the county, in the most spotlighted city in the center of the county?
Well, thanks, George. And well, it's people have stepped up. As Matt and Andre were both saying, we've had good compliance with mask wearing. I mean, we're 60,000 resident, but we, during the day in normal times, will probably hit 200,000 during the day. And so we've had a big shift in the way the city functions. And I think both Matt and Andre mentioned the food situation. I mean, that was the first thing I thought of, really, as this started to build momentum. I mean, the first thing I did was cancel the St. Patrick's Day parade. So I got some grief for that, but I don't. They've all disappeared. No one's really commenting on it.
It was
now.
heartbreaking for those of us who have Irish heritage.
Yeah, it was not done lightly, but it was clearly a thing to do, and I'm glad we did it. But concern about food insecurity. I mean, you have a lot of people here in White Plains who, if they can't go to work, they don't get paid, and they weren't exactly they didn't exactly have a big bankroll before this happened. So we actually stepped in and created a city. We have a lot of pantries in the city, but I felt they're going to be overwhelmed. We actually put together rather quickly our own food distribution system with 4 locations, and it was done. It was done on the fly. And for example, we could get more food if we go get it ourselves. So I talked to a local restaurateur, which is most people know, Peter Herrero of Sam's and American Barbecue and the rest. And he drove every day over there with his truck, brought the food in. We had an army of volunteers and some people in departments of the city that they couldn't do their normal jobs and wanted to be involved in this. And so that was really great. We put that together, and now we've kind of we brought it down, and we've worked with Grace Church to kind of fill in from now on. But it was amazing to me that in March, and I would be on the food distribution sites in March when no one really knew what we were dealing with. No one really knew much about it, and people were very frightened to leave their homes. People were treating a trip to the supermarket like it was the Normandy landing with the planning and everything. And we had people showing up to volunteer in the middle of all that. And I mean, a lot of people, including a nurse from White Plains Hospital who was already working crazy hours and showed up to do it. So it says a lot about the heart and the soul of your community. And our people really stepped up. For me, we've got a lot here. We've got a lot of businesses here. We have a lot of development here. The construction site shut down. Now they're all back up operating. We've got a hospital, a major hospital here. We had to deal with all kinds of issues surrounding that. And I was on the phone in the heat of it every single day. Now it's probably every other day. But I'm really pleased with the way our community did respond to the challenge. And as was also mentioned, I appreciate our working relationship and the great working relationship we have with the county. As people say, when you're in the middle of a crisis, that's not the time to exchange business cards. And that certainly doesn't happen in Westchester. We all know each other. We work together. And George, you certainly set a great tone in that regard. So I appreciate that.
Well, and Tom, I want to thank you and your team because being based here in White Plains, Westchester County government, we have major operations in Mount Pleasant and then a variety of other places as well. But the core of what we do is right here in the heart of your city. And the relationship between the city and the county couldn't be better. I do every so often talk to other county executives, and it's not always the case that the county city, and the county government itself always get along so well. So I'm glad we have a partnership here as well, and we can go forward. Dr. Endler, let's turn to you now. It was a year ago yesterday when we first had some dialogue about COVID. It was the very last week of January. You were already working on it prior to that, but I was drawn in the first time, January 27th, 2020. I had no idea what we were going to be facing. And now, of course, it took us a while before we got our first case, which we got in March. We're almost at the 1-year anniversary for that. We'll ask some specific questions from the audience in a second, but how do you assess this year? Obviously, nothing that you could have anticipated any more than the rest of us, but because of your knowledge of medicine, you obviously have a technical knowledge and skill that none of the rest of us have. How do you look back now over these last 365 days?
That's kind of crazy. I've been a health commissioner for about 15 years now and never had to use a quarantine or isolation order, maybe once or twice in my career. I can't even imagine how many quarantine and isolation orders have been issued under my name in the last year. So the first thing we had to do was define this disease. We didn't know what the natural course of the disease was. We didn't really know what the symptoms were, didn't know how it was spread. You remember early on, we didn't think you could spread it if you didn't have symptoms. So we had to figure out, what is this disease? What are the symptoms? How does it spread? How do we test for it? Initially, there was no test. CDC was the only one that had a test, and specimens had to be taken and shipped to the state, who shipped them to the CDC. We had no medications. There were no drugs. There was no one knew how to treat this, how to manage the disease. Patients in hospitals, doctors were taking care of them without a textbook that guided them on how they should proceed. And from all of this, I think eventually we learned how to manage the medical part of it. But for the health department, a big part of this was businesses had to stay in operation. People had to work. Schools had to be in play. How did we help them do that safely? So we had to take what we knew about the disease and the mode of transmission and use that to help businesses and schools and other entities be able to have employees come to work, have children go to school, and try to do it in a manner where people could be as safe as humanly possible. That was a little bit different role than the health department has played before. And a big part of that was education. I mean, you and I talked about COVID when this first happened and what we might kind of expect and what we knew and what we didn't know. But the general public knew nothing. And a lot of people really didn't believe that this disease was even real. And so a huge effort had to go into educating the public about what they had to do to keep not only themselves safe, but their families and their coworkers and everyone they cared about. So we've made it through all of that, and we've come to the day that we've all been looking for, and that is the day that we now have vaccines, more than one, two in fact, Pfizer and Moderna, and we're able to put vaccine in the arms of people to hopefully prevent the spread of this disease. And it is our goal now to try to ultimately get everyone who's medically able and willing a dose of vaccine as soon as possible to have our population protected so that ultimately we can all go back to some semblance of our lives as it was before COVID. And I think everyone looks forward to that day. We're all praying for it.
Well, we're that much closer to that day because of your fine work, and publicly, I want to thank you again. We are not done yet. We have plenty more mountains to climb, but we wouldn't have gotten this far without your professionalism, and we deeply appreciate it, Dr. Amler. So let's go to the questions. We have Catherine Chaffee here, Director of Communication. She has accumulated some questions for our attention. And Catherine, if you want to direct it to an individual, any other individuals want to chime in on the answer, let's proceed.
So the question we're getting asked a lot right now has to do with schools, and I know see you addressed this today during your press conference, but we have a lot of parents who are asking that the county change the policy regarding students being in school and the guidelines. Can you explain to the audience that this doesn't fall, who this falls to?
Sure. Yeah, I think it's important for people to know that while you don't need to get a master's degree in governmental structure, you need to have some idea of what each of these different levels of government are tasked with doing. Because when people are upset, they reach out, as you would expect them to do, to anybody they hear about. So if they hear your name, they come up to you and they talk about it. If you care about the filibuster rule in the United States Senate, you don't call Mayor Rainey or Supervisor you call your United States Senator. Those are the people that deal with an issue in front of the United States Senate. And I think we've all been very clear that in this pandemic, the governor has very early on in the month of March established that he was going to be the key decision maker for the vast majority of policies that will come out of the state. On occasion, he has devolved those decisions down to those of us in local office. Now, absent a gubernatorial proclamation, as a county executive, as mayors, as supervisors, we would have certain types of authority within our executive power. But that was taken and aggregated to the state because he wanted to have a singular way to approach issues that cut across all these different community lines and county lines and so forth. Very good. So whether it was testing, collection of data, and now decisions on vaccines, decision on what stays open, what doesn't, the governor makes these announcements. Governor makes the announcement a couple of days ago, we lift the yellow and the orange zone. Governor made the announcement because the governor has the authority. The governor made an announcement a couple of weeks ago in which he indicated that New York state policy would change. Instead of getting vaccines from 75 years and older, it became 65 years and older. That decision was made one day after the prior policy was established. And again, that is within his authority as the governor of the state. So there are parents out there that are frustrated, and understandably, about the various issues that that face school students. We've had issues that relate to elementary school children and whether or not they should be allowed into school relative to 3-foot, 6-foot distancing. There are questions of all sorts of natures that go into the education process, and parents are concerned. They see their children at home. They're worried about whether they're getting the proper education. There are some parents who hold the exact opposite positions. They don't want children to go into school. They prefer they be remote, and all of that debate happens. There's a certain amount of the decisions that belong to the school board and the school superintendent. But on the particular issue that came up most recently, I think in Eastchester, perhaps in Scarsdale as well, folks have indicated that decisions were being made at the county level of government relative to this, and it is not. In the case of the guidelines for elementary school children and what it will take for a school to be open and operative, those guidelines were established by the New York State Department of Health. It is their authority to establish those guidelines. And if the state decides to change their guidelines, they have that prerogative. And we've seen it in a number of areas. We saw a couple of weeks ago in orange zones, because of a court case in upstate New York, the state changed its definition of what could happen to restaurants in the orange zones, which applied in our county only to the village of Portchester. Previously, all indoor dining was prohibited in the orange zone. And then they changed the policy. They opened it up so that with certain restrictions, you could open indoor. And that change of policy came from the state exerting its authority. So for any of the folks out there that are concerned and they're saying, well, why doesn't the county executive or the county government do these things? For that matter, why doesn't the county legislator do something? Why doesn't a state legislator do something? I saw my mayor, my supervisor last week. How come they're not doing anything? Because all of the rest of us as elected officials do not have the authority that now resides in the governor. And the governor has taken on that responsibility. He has his daily, opportunities with the press to talk about what he thinks is important. And those powers belong to him, and rightfully so. And he's now executing it. So for any parents out there who are concerned about policy A or policy B, and there's a wide range of them, there's a way to look at those policies. You can go into the New York State website and look for executive orders and interpret them and so forth. But in most of these cases, these are state health department policies that have been established. And unless the governor specifically gives us the authority to make a decision on something, we are left out of that process. Now, he did almost a week ago, give counties the authority to decide whether or not we wanted to permit high-risk sports to be played at various high schools. That was a decision that he kept to himself, that he kept out of power and prohibited from high-risk sports. And then he announced late on the day on Friday that he would devolve that decision down to the county health departments. And Charlita, sorry to report, he didn't tell me that I had to make the decisions. He said that you and the county health department officials have to make those decisions. Now, because Section 1 Sports, which is the association that our high schools play in, and it's a multi-county, Rockland, Putnam, Dutchess, et cetera, we took the initiative to reach out to the other county executives, Ed Day in Rockland, Mary Ellen Odell in Putnam, Mark Molinaro in Dutchess, Steve Newhouse in Orange. We included Pat Ryan from Ulster County. And we had a discussion about this as a matter of public policy. And we decided as county executives that as long as schools were following the state protocol that is established, and there are collegiate sports being played under those protocols, that we would not stand in the way of that happening. But the decision on that particular situation was given to the county health department commissioners. And of course, if you're going to do something that's multiple county, you need to have those entities working with each other, talking with each other, and coming up to some decisions. So for the questioner who may be concerned about a particular issue with elementary school children, it is state Department of Health policy. They have issued the regs. They have set the parameters for which something would happen. If there's going to be an overall change in policy, it is within the governor's authority to change that policy, to impose something or to take something away. And that is where the advocacy is directed. All of us are advocating in various different issues with the governor. And I think, as in most cases, you have those conversations directly with staff. And the analogy I used in my 2 o'clock update was, if I wanted to influence my father on something when I lived in his house, the last thing I would do would be to tell everybody else in the neighborhood or put it in the local newspaper. That was a sure way to get my father to do the exact opposite of what I wanted him to do. So you have to grant that advocacy may not be visible. It may not be something you see. It's something that's happening amongst individuals who are trying to influence each other, and not by shouting them out, but trying to develop facts, trying to show them what's actually happening on the ground in the yellow zone of Peekskill and what's happening on the ground in the yellow zone of Ossining. And when you look at stats and information, that helps you make a decision to change the direction you're going in. Next question, Catherine.
And it is for Mayor Rainey in Peekskill. A resident has asked, seniors and others in the community have expressed concern and are curious, nervous, and some are very reluctant to take the vaccine because they're concerned about the safety of the vaccine. How can you assure them that it's safe? What is your message to these residents?
So, all I can do is follow the information that I get from the health experts. I'm definitely not an expert in health in the health department, and I definitely can say I don't work for the Department of Health. But any factual information that they share with me is definitely my responsibility to make sure I get that information out to my entire community, however I know best. We've definitely, the city of Peekskill has worked with a PR consultant for the past 2.5, 3 years, and we're looking to get another one just to try to make sure that we get all of the information that we receive out to the community on every platform. We've revitalized our Facebook page about a year and a half ago. We take advantage of our government channel, our city website. We're even looking at creating Instagram and possibly Twitter, just to be able to get this information out to any and everyone. Because when I was growing up, we used to receive a lot of stuff in the mail. You can see newspapers. We even had cassette tapes back in the day. So there are new ways to get the information out to the people. And like I said, all I can do is make sure that the factual information that we receive from the health experts is the information that I'm going to distribute to my community.
And Dr. Emler, let me ask you to opine on this, because you no doubt hear these concerns about the vaccine. I hear them. We all hear them. I had a friend of mine who's not involved in government tell me, I don't know if I'm going to take that vaccine. What's in it? And I challenged him. I said, you eat hot dogs. You know what's in hot dogs? And, a humorous way to sort of get the message across that civilians are almost always going to not know what's involved in a medical situation. So how do you generally respond when somebody says to you, I don't know what's in this, the testing put this on the market so fast? How do I know that it's safe? How do I know there's no long-term effects? How do you respond to those kinds of objections when you hear them?
Well, I think in medicine, it's always about the risk-benefit ratio. So whatever we're dealing with, whether it's giving you an antibiotic or any other drug for any medical condition you have, or a vaccine to prevent a communicable disease, you're looking at what could happen if you don't take the medication versus what is the benefit if you do take the medication. And I think it's abundantly clear that in this country, over 400,000 people have died as a result of COVID, but I'm not aware of anyone who's died from the vaccine. So, give me a headache, give me a little bit of a fever. If that's going to be the worst that happens to me and I survive COVID, I think that's a risk I'm willing to accept personally.
Very good. Catherine, next question.
The next question is for Yorktown Town Supervisor Matt Slater. Considering the numbers in the county right now and the numbers in your municipality, the public would like to know what you're doing to have people wear masks, encourage people to wear masks, practice social distancing, and sign up for the vaccine.
So it's a great question. And like we just heard from Mayor Rainey, a lot of it has to come down to communication. We've been very forceful with the mask wearing, with the social distancing, with the making smart decisions, responsible decisions. We've been messaging that from day one. Again, listening to health experts, listening to people like Dr. Amler right here on our show tonight. And so I actually think that the compliance has been really good here in the town of Yorktown. I think that living room spread has been an issue, but that's not an issue just centered around one community, not just around the town of Yorktown. I think that we've seen that across the region, across the state, and across the country. And the governor himself has shared statistics that showed 74% at one point of the coronavirus spread was linked back to living room spread. So again, I don't think that's Yorktown specific. But we've continued to provide this information. We continue to provide guest appearances. Again, we've had Dr. Amler herself on. We've had Dr. Lewis Cole of Caremount on. We've had the president of the New York Presbyterian Hudson Valley Hospital Center on. So, we continue to provide a number of individuals we consider and who are considered experts in these matters. Because it's one thing for me to say time and time again, wear masks, practice social distancing. But I think it's important when you have verifiers with medical backgrounds and expertise to explain, just like Dr. Amler did, the importance of wearing a mask, the importance of social distancing, and the importance of the vaccine. The vaccine, I believe, is very safe. Again, I think that we have to follow the science on these matters. I also follow my wife. My wife says that the vaccine's safe, so I listen to her too. But
Always a good
in all
strategy.
seriousness, thank you. But in all seriousness, to Dr. Amler's point, the risk and reward situation is real. We all want to get back to a sense of normalcy, and we're only going to get there once we get a number of vaccines through the community, through the town of Yorktown, through Westchester County as quickly as we can. And I can also say that there has been a significant demand for the vaccine here in the town of Yorktown. We had an episode just last week. Acme supermarket in Yorktown Heights had 200 slots for vaccines. They were filled in 11 minutes. And thankfully, again, with the partnership of our county executive and the Department of Health, we're looking at hopefully establishing more vaccination centers here within our community. I was just with members of the Department of Health just yesterday with our town clerk, Diana Quas. We were touring some sites where we hope to hopefully have a vaccination center approved. But again, I think that we have to be smart. We have to listen to the experts. When my car breaks down, I don't pretend to know what the problem is. I bring it to a mechanic, someone who actually knows the ins and outs of a car. When my son or my daughter gets sick, I bring them to the doctor because I'm not a doctor. So I let them diagnose the situation and prescribe a solution. And I think it's the same here. We have to trust the science. We have to trust our medical professionals. And by the way, our medical professionals have been miraculous in coming up with a vaccine in such a short amount of time. And so, from that standpoint, I think our community is very confident in the vaccine. I understand there are some folks naturally who may be doubtful of it, but I think if we all want to get back to that point of normalcy and have a normal summer, hopefully, keeping our fingers crossed on that one, that the proper administration of the vaccine is key.
Very good, Matt. Just very briefly for Tom and Andre before we go to the next question. How do you see the trend line in mask wearing in your communities? Is there greater compliance from where we were before? Still having the same difficulties in getting compliance? Tom, Andre?
Yeah.
We've had solid compliance really from the beginning. I mean, at first we would get a few phone calls saying a certain restaurant, they're not wearing their masks, and we would go over and talk to them. We would talk to the supermarket where, in the beginning, people weren't necessarily getting the importance. And I was stressing the mask right from the very beginning, even when they were saying it's really just to protect others, or even in the beginning when they were saying you didn't need to. I felt like this was going to be important, and we've seen a great response. People will see someone without a mask, and it's upsetting to them, and they will contact us.
Right.
But for the most part, in my walking around and just sitting in my office watching as people go by, we've got great compliance, and I think it's a reflection of the fact this part of the country was hit very hard, and in the spring, other parts of the country they didn't know what it was. They went to the Sturgis motorcycle rally, which was ridiculous and created all kinds of trouble. But here, I think people took it seriously. We had morgue trucks behind the hospitals. We all know people who passed away as a result of it. So I think people here don't have to be convinced that it's serious, and I think it shows in their compliance.
Yeah.
And Andre, very
Thanks for asking
quickly,
the question.
what's the Peekskill experience?
Yeah, now I think we're top of the line. I'll be honest. At the beginning, I don't think we had the community compliance as much as we hoped for. And once we started distributing masks and you started hearing the death toll, rise higher and higher, I think it kind of convinced people that this is not some sort of hoax. We had a leader at the top. Our president was kind of influencing that decision for many people to believe that this may not have been as serious as possible. Then I remember there's a statement that he had when he had mentioned that it was going to be by Easter, we'll all be able to go back to church. So you have the mayor of your city saying wear a mask or else, and you got the president of the United States saying you'll be fine by Easter. So it was a challenge at the beginning, but towards that summer when we started shutting down, parks, started shutting down, asking restaurants to shut down and minimize their staff, and when we started making some real drastic changes to save lives, I think that's when it got better. And then you started seeing, like I said, the local Bean Runner Cafe, they were making 1 to 300 masks a day. I mean, I'm sorry, a week, giving them out free. And then the county, you guys definitely came down with boatloads of sanitizer for the community and masks that we're still giving out. And I'll give a shout out to our councilwoman Patricia Riley and Deputy Mayor McKenzie. They sat outside with me a couple of days in front of the neighborhood center in Peekskill, just giving out masks. And I think the first maybe 3 to 4 months, I don't think our community really took it as serious as it is. But now, after the spring summer hit, that's when our community has been in compliance. And the cities, we put up about 200 signs throughout the entire city, and promoting social distancing and mask wearing. So now I think we're definitely one of the top of the line cities, in staying in compliance.
Very good. Thank you, Mr. Mayor. Catherine, next question.
Questions from people who want to know how the vaccine is being distributed, how the process works.
Well, I'll start with that, and to the extent that anyone else wants to chime in. State designates the locations that will receive doses of vaccine to distribute. And as it stands now, the county government is involved in 2 locations. We are partners over at the Westchester County Center, a facility that we own, but we turned over to the state back in the beginning of the pandemic, originally to be used as backup hospital space. And then it's now been used, was used for antibody testing, and now it's being used for vaccinations. And they've laid out a very smooth operating entity. They can run through 1,100 people a day. You can probably do more than that, but right now they're doing 1,100 a day there, which is a significant situation. And then we also have the White Plains Health Clinic, which is right up the block from us in downtown White Plains, about 1 mile away from the county center. And that facility has done 300 to 400 in a given day. They opened their efforts a little over 3 weeks ago. County Center has been operating 2 full weeks prior to now. And of course, the shots that you're required to take, 2 shots, require everybody who's gotten a vaccination are ready to come back again for a second round. Some of the people that got their initial shot at the clinic in the first week are now coming due for their replacement shot. We know that right now we're vaccinating a small cohort of the general population. The way the governor has set out the parameters, 1A, 1B, 1C, and so forth, different categories of people eligible for the shot. Right now, if you're 65 years of age and older, you can get a shot. Right now, if you work in certain key essential service positions, first responders, police, fire, EMS, hospital workers, high public contact employees, bus drivers, funeral directors would come in contact with people through doing their function of dealing with those who've died, and all of those people and many more have to be protected. So they're also eligible for the vaccine. We do not yet have vaccines being distributed to anybody under the age of 65, and that includes people that may have other health issues. As much as the comorbidity factor is a serious factor, we find ourselves in the circumstances where people come to us and the person says, I'm 57 years old and I have heavy duty asthma or COPD. The regulations as we have them, and Charlita, correct me if I misspeak here, the corrections as I have them is that you either must be 65 and older or part of one of those essential professions to get a vaccine. Now, looking ahead, if the federal government can provide greater quantities of vaccine to New York State, all the states, but New York State, and New York State commensurately is able to provide us with a higher percentage of vaccines, we're going to be prepared to do a heck of a lot more than we're doing now. We're going to look for additional sites. We already have that process underway. Some of them might be a permanent site like the county center or quasi-permanent. And then some of them might be a pop-up situation where for 3 weeks, we're going to be at such and such a location and in a community, and people from that community can go to that site to get proper vaccination. And what we're looking at is knowing that once we open the doors to everybody, it is going to be a tremendous, tremendous surge of interest. We won't have all of them. Ultimately, what, 20% don't want to take the vaccine at the end of the day, but that 80% that does will flood our system immediately. And so we have to be sure we have enough doses to make a legitimate appointment for them, and also that we find these additional locations and soon, and get them in a position that can be used for the purpose that we've identified. Anything you wanted to highlight, Dr. Amler, to perhaps amplify or enhance my comment?
Well, I just want to say, I know that a lot of people are very frustrated. They go on the app and they can't find a vacant spot for an appointment to get the vaccine. And I would say just, stay the course, keep trying. Eventually, things will open up. In the meantime, the most important thing you could do is all those things that we've talked about for months: the mask wearing, the social distancing, the avoiding large crowds. Those are the things you need to continue to do to stay safe until you can get an appointment and get your vaccine. So we all just have to be a little bit patient. I know it's difficult. I have people that call and sometimes they're quite upset. They're frantic for family members and loved ones, and they want them vaccinated as soon as possible. We all want that, and we're all working towards that end. But we just have to continue to do the things we know that are going to keep the people we care about safe until they can get a vaccine.
Sounds good. Yes, go ahead.
Well, that's a great point, Dr. Emler, because there are a lot of people here on Facebook tonight who are expressing frustration in not being able to get an appointment. So for all the people out there who have not been able to get an appointment yet, please, as Dr. Emler said, please just keep trying and keep trying, stay the course, and hopefully you'll get an appointment soon. The next.
And again, I just want, just before you go to that question, I just want to repeat, the reason why you're not getting an appointment is not because the system is deficient. It's because we don't have enough committed doses that we've been given that we can then make those appointments. It's if you go to the county center and you go through the system, or you go to the clinic, go through the system, it's efficiently well run. And those are people with appointments, your ID is checked, and you get right through the process. But the frustration that you have is because the demand for the vaccine exceeds the supply that has been made available. And I have to say, through the federal government, there's a new government in charge now for the last week, 8 days, whatever it is, and they are obviously trying to play catch-up baseball. But the stockpile of vaccine is not sufficient to give us enough vaccine commitment so we can make the appointments that satisfy you when you call. And I understand just how frustrating it is. People stop me every day looking for appointments for vaccines.
The next question is from Mayor Roach. Can you talk about the importance of leading by example? What does this mean to you in terms of the pandemic and the vaccine?
Well, I think as Mayor Rainey indicated, we had bad examples set in Washington. To me, it means practicing what you preach. So I've got my mask right behind me here. I whenever I'm alone in my office, I take it off. But when I go out to get a drink of water or whatever, I put my mask on. I wear my mask everywhere when I'm outside. When I'm running, I have a gaiter, but I'm running in places where there really aren't any other people. I think it comes down to the vaccine too. I received a communication from a pharmacy that said, "Hey, we're getting vaccine. Have you gotten yours yet? We'd like to, no, I'm not qualified yet. I'm not eligible yet, so I'm not doing it." But I would say too that the vaccine is safe and effective. It's gone through incredible trial. It has there's a lot of reasons why the process accelerated, one of which is to save lives. But the disease became so pervasive that the tests went more quickly than they expected because enough people were getting sick that they could make a comparison. But I think we just have to we have to just encourage people to do the right thing, and I think we have to model the behavior that we want to see them engage in. And for me, that's easy because I believe what I'm preaching, and so I live it.
Very good.
Meryl on Facebook would like to know how we are assuring equity of distribution in Black and Brown communities for the vaccine.
Well, I'll start with that, and then Charlene will give you a chance to comment again on where Tom was on evidencing things. We know that we are going to need to do an aggressive outreach in communities of color and communities of poverty. We don't have the kind of existing healthcare infrastructure in the poor areas that we should have. City of Mount Vernon, we talked about this when Mayor Patterson Howard was on last week. The hospital that I was born in downtown Mount Vernon is in the process of being phased out, closed by its ownership. And that's a city of 60,000, 65,000 people that doesn't have the ability to use a facility like that to help reach the people in the city of Mount Vernon. We also know, and I think it was touched on in some of the other comments, that aside from the infrastructure, people are not as mobile. They may be less likely to have cars, less likely to be able to get someplace that's outside of a reasonable walking radius in their home community. And we can't deny that there have been situations in history where people of color have been used in experiments, and it creates a certain built-in suspicion for anything that happens in which the official voice says, you should do this or you must do this. And that reticence, in my judgment, can't be overcome by you lecturing somebody. It can't be overcome by you telling somebody, and by God, don't insult their feelings. But it does matter. It does become a matter of persuasion and trying to put the right voices available to answer the questions you have, and to show that there's a cultural connection between you and that portion of the community in the medical community that can give you the rationale for why this is all necessary. But Charlita, I'd like you to try to add on to that answer, because again, it's about the question of outreach into communities of poverty and color.
Absolutely. And I would start by saying, I think you're always right that the best place to start is with your family physician, your family doctor, someone you trust, and who you've listened to their advice in the past, and just have a conversation. What is my real risk? Your doctor will know what underlying chronic medical conditions you have that may or may not place you at increased risk of death were you to get COVID. And how important is it for you to get vaccinated? The good news is that this vaccine is very effective. About 94 to 95% of people who receive the vaccine will be protected against COVID. And what that means, if you took 100 people and you vaccinated 100 people, about 5 of them might not be immune to the disease, but 95 of them would be. And for a vaccine, that is a very, very strong showing. Most of the vaccines that we give every day do not have that kind of an efficacy profile. Also, I would just say that although there's not enough vaccine right now, vaccine is being manufactured and put out on the market every week, more and more. They're looking for hundreds of millions of doses. And in addition to that, Johnson & Johnson has a vaccine that is currently in trials that should be reviewed very shortly, and hopefully will receive its emergency use authorization potentially by the end of February or March, and that will add even more vaccine to the pool of available vaccines. So every week there's going to be more and more vaccine coming into the market, and we just have to like I said, stay the course, keep trying to get an appointment. And for people who have hesitancy about the vaccine, reach out to a trusted source, someone that you trust and value their opinion, who is qualified to give you that advice, and listen to what they have to say. I think that's the best thing that I could tell you about that.
Thank you, Charlita. We have just a few minutes left. We'd like to try to get another question in if we can.
Absolutely. So the next question is, if I've received this person has already received the first dose and they are concerned about their second dose appointment being canceled, can that be guaranteed that it will not be canceled?
Well, I think I've got a reasonable expectation that if you've gotten the first dose, you will get the second dose. Now, when you say a reasonable expectation, I feel highly likely that will be the case. No one can give you 100% guarantee. And there's a fear factor out there that just multiplies with things that are unknown. But I have confidence that if you got your first shot, that we have reserved enough quantity of vaccine to accommodate your second shot. So unlike some proposals that I've heard out there, we're not going to take our stockpile of second shots and give them out to more people for first shots, because you're not going to be properly protecting anybody if they're only operating on one shot. The second shot is essential for the Moderna and for the Pfizer vaccines. I have heard that the Johnson & Johnson product, when it comes on market, may only require one shot. And we'll find out more about it if it passes FDA approval and gets out into the marketplace. So we'll see what happens with that. We are just about done with our hour together. And I know the number of questions far exceed the amount of time we had. And I wanted to make sure we could visit with our guests while they're on the air with us. So we're very appreciative to have Mayor Andre Rainey from Peekskill with us, Supervisor Matt Slater from Yorktown, Mayor Tom Roach right here in White Plains. All three of them are on the firing lines, and all like every other elected official and many appointed officials, trying to deal with things that we had no idea were going to happen to us. But here we are, gentlemen, doing the best we can. And we're very fortunate that we have the likes of Dr. Charlita Amler, Dr. Dial Hewlett, the other people in her department who give us the professional assistance that we need in order to make the right decisions. And we hope, as as people that are tasked with looking out for our fellow citizens, that we will make the right decisions. We'll take the right advice from the healthcare professionals. We'll get through this. I often talk about the conversations I had with my parents about what the Depression was like, what World War II was like. And in the middle of the Depression, nobody knew when it would end. And in the middle of World War II, nobody knew when it would end. And we don't know when we're going to finally be rid of the masks and be rid of COVID. But what we do know is that we're going to work as hard as we can, all of us. There is no difference between the levels of government that we're in. There is no difference in our party affiliation. We are committed as a group of individuals to get to the same end product. And so again, thank you, Dr. Amler. Thank you, Supervisor Slater. Thank you, Mayor Roach. Thank you, Mayor Rainey. And thank you for watching. We will be back here at 2 o'clock on Monday with our next coronavirus update. If we have reason to communicate more quickly, we will. And we know that Mayor Roach in White Plains has regular robocalls. We know that Mayor Rainey and Supervisor Slater reaches their community. I think Matt's got Friday afternoon updates online in Yorktown. And Andre, when do you have yours, Andre?
Every Tuesday morning.
Every Tuesday morning. Good. Put out your calendar. It's all must-see TV. And we're very happy that you tuned in today. I'm George Latimer, Westchester County Executive. Thank you very much for your time. Be safe and have a good day. Good evening.